Well, hello. My name is Norman Lamb. I'm the New Liberal Democrat health spokesman. We're at the moment developing policy on health, and we'll take a paper to the autumn conference. And I'm very keen to get views from members on the development of that policy. You can visit the consultation website to find out what the paper says at the moment, and then to give your views, and I'm keen to hear from you. If we look at what's going on in the health service, I think we can say that we were absolutely right to support the extra investment in the health service. That's something that the Conservatives didn't do, and if they had had their way, the health service would be some 35 billion short of where they're at now on health funding, and I think the consequences of that would have been disastrous. But how has the money been spent? It seems to me that the government has wasted an awful lot of the money. They've overspent on the budget for the GP contract, for the consultants contract. They've introduced a national IT scheme which is behind schedule and also over budget, and they have constantly reorganised the health service. They introduced primary care trusts 3 years ago and then abolished them and created bigger bodies now, and every time the cost of change, redundancy packages, early retirement packages, costs the health service money which could be going into patient care. And at the moment, much of the health service is deep in deficit, and it's causing havoc for patient care in many parts of the country. We're seeing the loss of incredibly important local services, and I think that the Liberal Democrats need to be at the forefront of campaigning against the loss of those services. So what do we think about the development of the health service? Well, first of all, Liberal Democrats are passionately committed to the NHS, but we think that we need to organise it on a more local basis. Instead of everything being directed by the Secretary of State, we think that local people, local communities need to have a say about the development of their local health services. So that's really what I'm keen to hear from you about. I want to develop a model of decentralised healthcare. We're going to visit Sweden and Denmark to see how they do it. They have much more local control over their health services. So do get in touch. We want to hear from you, and I hope very much that when we come back in the autumn, we will have developed a policy that all Liberal Democrats can sign up to, and that gives us something distinctive, something that's coherent, and something that's distinctively liberal to say about our health services. Thank you very much.